So next is administering intradermal medication for skin tests. So the first step in this procedure is to perform hand hygiene and observe the appropriate infection control procedure. The rationale for this is to reduce the transmission of microorganisms. Next is prepare the medication from the vial or ampule for drug withdrawal. The rationale for this is preparing will save you time and be able to be ready to administer the medication. Next is introduce yourself and verify the client's identity. So this ensures that the right person receives the medication. So for example, our client is this tomato. Next is explain to client that the medication will produce a small bleb or small circle. Then explain the rationale for this is explaining it to the client will help them to understand the situation. Next is provide privacy. The rationale for this is by providing privacy. This is to ensure the client's privacy and safety. Merge. So next is select a site. The rationale for this is the site should be free from lesions, rashes, and moles. By selecting the correct site allows for accurate reading of the test site at the appropriate time. Then cleanse the skin at the site using a circular motion starting at the center of the widening and circle outside. The rationale for this is pathogens from the skin can be forced in the tissues by the needle. Allowing the skin to dry prevents introducing alcohol into the tissue, which can be irritating and can be uncomfortable. Then expel any air bulbs from the syringe. So the rationale for this is injecting a small air bulb into the skin of the muscle usually is harmless, but it might mean you aren't getting the full dose of medication, but because the air takes up space in the syringe. Next is grasp the syringe in your dominant hand and close the hub holding in between your thumb and forefinger. The rationale for this is this allows for easy handling of the syringe. Like this. Next is hold the needle almost parallel of the skin surface with the level of the needle up. The rationale for this is keeping the level side up allows for smooth pursing of the skin and introduce of the medication into the dermis. So with the non-dominant hand, pull the skin at the side until it's taut. The rationale for this is taut skin provides easy entrance for the needle. So the next is insert the tip of the needle far enough to place the bevel through the epidermis into the dermis. The rationale for this is inserting the tip is enough to create a belt. So next is stabilize the syringe and needle and inject the medication. The rationale for this is stabilizing the needle will help prevent complication, and injecting slowly ensures the safety of the patient. Next is withdraw the needle quickly at the same angle in which it was inserted. The rationale for this is withdrawing at the same angle prevents the tissue damage and increased pain at the injection site. Next is do not massage the area, because the rationale of this is massage is not necessary and can damage underlying tissues. Like massaging after a heparin injection can contribute to a formation of hematoma.
Wait, stop.